Now, if I told you that we were on the brink of a Greek-style financial collapse in Alberta, you probably wouldn't believe me. Now, it's true we don't have a debt that's 120% of the size of our economy, and it's true we're not being hamstrung by an excessive amount of finance charges to be able to support a huge debt. It's also true that Alberta's troubles aren't threatening to cause a nationwide currency crisis, as it is over in Europe. But in a very real sense, the way that we deliver our social programs in Alberta is bringing us to the brink of collapse. In healthcare, in particular, the collapse has already begun, if you've been following any of the stories in our province over the last few weeks. It wasn't that long ago, in August of 2008, that we were talking, our government was bragging, actually, about having record surpluses. Well, today, just 2 years later, we're now running record deficits. We called the most recent provincial budget in our province a train wreck, and it was. We had a second quarter fiscal update just yesterday, and in fact it's even worse than what they projected when they released this budget a few months ago. Our finance minister delivered a budget that has an all-time record deficit of $5 billion, which is the biggest in our province's history. But it doesn't stop there, because we've also started playing with the numbers so that we can hide some of our deficit. We've got an additional $2.7 billion in the form of capital borrowing for new capital projects that they don't include in their deficit figures. So if you add these two numbers together, in Alberta we're actually facing a cash shortfall this year of $7.7 billion. Now keep in mind, our budgeted spending is about $36 billion. So this represents 20% of our total budget this year. To understand as well just how out of whack this level of spending is, do consider this. The government in Alberta is still also budgeting to receive another $7.5 billion this year of resource revenues. So this means that we would actually need to have resource revenues of $15 billion to balance our budget. To put it another way, if we didn't have resource revenues to rely on, we would actually have to see a 40% increase in our overall amount of taxes to be able to support this kind of spending. It's clearly not sustainable. And it's clearly a revenue, it's not a revenue problem, it is also clearly a spending problem. And it's a problem that economists and commentators have been talking about in our province for more than a decade. The day after the province released its budget, the Wild Rose, we released our own alternative budget. And we put forward a few concepts for how we would be able to get back in the black. And I think some of these concepts are going to be relevant in Saskatchewan and other provinces as well. Saskatchewan faces the same challenge that we did back in the 2000s when we saw a huge boom in resource revenues. I think that our provinces tend to do quite well in managing when the times are lean. What the challenge in Alberta has been, and I think this will be an increasing challenge for your province, is how to manage surpluses, how to be able to restrain spending when you have more revenues than you can spend on your current program spending. So one of the things that we suggested in Alberta was having a spending rule limitation, so that you would not see year-over-year spending increases any greater than inflation plus population growth. And this is important, because if we look back through our history, if we had had this spending rule in place through the last decade, we would not be running a deficit at all this year in our province. We would actually be running a $4 billion surplus. The second thing that we looked at doing in Alberta is restraining capital spending. Now I know that this province is in the same position that we were in, which is when you get new resources, you look at all of the different infrastructure shortfalls and deficits, and there's a mad rush to be able to try to do all of those projects. But you can build too quickly. It can cause inflation, as it has in our province, and also it can cause us to invest in capital projects that we can't afford to operate. So let me tell you a story about where we're at in Alberta, because it links to some of the comments I'll make later on healthcare. I don't know if any of you have seen that Yes Minister or Yes Prime Minister episode. Is one of my favorites, where Jim Hacker gets called out to give an award to a hospital in Britain. Best run hospital, it's got fabulous administration, brand new building, great new technology, except for they're not receiving any patients because they ran out of money to hire nurses and doctors. And this is actually happening in Alberta. We have a $600 million center that just opened up a couple of weeks ago. And they announced that they were only able to open up 2 of the 21 operating rooms because they didn't have the money to staff it. And they announced that they were going to open up about 30 of the 150 hospital beds. So we're now in the realm of satire in the way we're running our healthcare system. And this is the result of what happens when you race to spend money on capital faster than you're able to support it. Hopefully the Frontier Centre will do some work on this, on how to give some guidance to governments about how they can get this piece right, because I think we end up seeing governments make the same mistake over and over again. The third thing is we would end corporate subsidies. Now I know you've got a different culture here, so I don't want to say too much about your crown corporations. We don't have very many crown corporations in Alberta, but we do have an attitude in Alberta that we're very reluctant to get into the business of business. We do believe that when governments try to pick winners and losers, that taxpayers end up the ultimate losers. And we've got a number of programs in Alberta that are causing, I think, a lot of consternation for those of us in the Wild Rose Party. I've often said that if you give money to a local government, even if they spend it badly, you still get something for it. You may get a road that's wider than it should be, or you get an art gallery or museum that may be a little grander than you would have expected, but at least you can see something tangible. In Alberta, we're going to be spending $2 billion to give to private companies to figure out how to bury carbon dioxide underground. And who knows if this is even actually going to work. But that is the kind of thing that we're seeing in our province, and the kind of thing that we think would allow us to get back into budget balance faster if we would eliminate these kinds of direct grants. And the last thing I would say, and I think this is probably something that Premier Wall is already well at work on here, is addressing the manager-to-worker ratio in the civil service. There was a number of negative news stories that came out last year because our government gave $44 million of managers' bonuses to the top management in our civil service, right in the middle of a recession. But the good news, at least, about those levels of bonuses is now we know how many managers there are in the civil service. So there were 6,700 people who qualified to receive those managers' bonuses. There are 30,000 people in the civil service. So that means, on average, you've got one manager supervising 3 or 4 employees. So for those of you who are in the private sector, you'll know whether or not you think that's reasonable. But let me tell you about another company that's based in Calgary that has a different management structure. This is Westjet. Westjet has 7,500 frontline workers, and it's got 300 managers. So it's got one manager in every 25 employees. So if we had a management structure in the civil service that was even half as good as Westjet, we would literally be able to eliminate thousands of civil service middle management jobs, layers and layers of bureaucracy, without impacting frontline doctors and nurses and teachers and education assistants. If you're wondering where all the money goes, which is a lot of what our folks in Alberta are asking, that's where a lot of the money goes, in the way in which we've seen an increase in spending without seeing an increase in performance. I think we have an opportunity over the next 10 years with the graying of the workforce. We know that people are going to be retiring. You have to choose the management structure you want to move to, and then as people retire, you just don't replace those positions and you can reorganize the administration. So I think we have a real opportunity to be able to resolve this problem. But the main question is, what is driving all of this overspending? And of course, the answer in our province and most other provinces is healthcare. Let me just share with you a few statistics to set the framework for this discussion from the Institute of Health Economics, from their 2010 Handbook of Health Economic Statistics. Did you know, for instance, that Canada has the 4th highest per capita spending in the world? New Zealand and Japan spend about half as much as we do. They spend about $2,500 per person. In Canada, we spend about $4,900 per person. And we actually, in Alberta, are the highest spending province in the country. We spend about $260 more per person than you do here in Saskatchewan. Canadian specialists are also the 4th highest earning in the world in earned income. And Alberta has the highest paid doctors and specialists in Canada. This is why you're wondering why your costs here are escalating, is because you're trying to keep up with what we're doing over in Alberta. Alberta GPs, though, still are paid 15% more than your GPs here. And we also get, our specialists are paid about 6% more than your GPs here. Canadian nurses also have the 2nd highest starting salaries, just behind private sector nurses in the United States. Alberta nurses have the 2nd highest minimum starting wage per hour. And just to put this in perspective, we pay nurses as much as $3.70 more per hour than you do in Saskatchewan. We also have a problem with the electronic health records, which are supposed to be a way in which we can improve efficiency and performance. We hear that some doctors and nurses, for instance, are currently spending as much as 20% of their time doing data entry. If we had a more effective electronic health record, we'd probably be able to do a lot more work in being able to make sure that we can reduce those numbers. But 37% of Canadian doctors use electronic health records, compared to New Zealand and Australia, where it's 96%. Albertans also, average length of stay in hospital is 7 days longer than in the Scandinavian countries. In the Scandinavian countries, the average stay in hospital is 4.7 days. Now keep in mind, every additional day a patient spends in hospital is costing about $1,000 per day to the system. So in Alberta, we're spending 2 whole days longer. In Saskatchewan, you're a little bit better, 6.1 days on average, which is still nearly a day and a half longer. Also, when you look at the mix of public and private, I think this one is important. I do acknowledge that I'm in the heart of the seat of where Medicare began in Tommy Douglas, so I do tread here quite carefully. But 73% of health expenditures in Alberta are public funds, and that's higher than the Canadian average. You are actually higher here. 76% of your health expenditures overall are public. Also, Canada's pharmaceutical expenditures per person are the second highest in the world. We're behind United States, and we're also nearly triple what they pay in New Zealand. Alberta has the second lowest level of home care. You probably know that home care is a great way to be able to save money. We only spend $82 per person on that. You're doing a bit better than us here. You're paying $110 per person. So what are we getting for all this money? You would expect to see that we were getting positive results. Well, Alberta infant mortality, one of the key measures of a healthy population, is actually double what we see in Sweden, Japan, and Finland. We've got 6 deaths per 1,000 live births, compared to about 2.5 in those other countries. In Saskatchewan, it's slightly less. It's 5.8 per 1,000 live births. Canadians also, when you look at OECD data, have the most difficult time accessing immediate care.